How worried should I be about the new canine influenza outbreak?
Okay, I'm getting this question a lot. People are calling the vet clinic and they're asking, they want to know. And it's good because this is important. There is a new strain of canine influenza, and today is April 22nd. So this information I'm giving you is up to right now. It's changing really fast because things are going on really fast. Here's what we know. Here's where we're going. Okay, this is a new strain of canine influenza. It's an Asian strain. It's different than the American strain of influenza that we've had for some time. That means two things. One, it means that dogs here in America have not been exposed to this before. And if they are exposed, they're likely to get it. Okay, so there's not a lot of immunity built up. Number two, our vaccines, the influenza vaccines, they probably don't work against this. So know that's what we're dealing with. Right now, the disease is confined to the Midwest. The Chicago Tribune says that there's been more than 1,000 pets that have been infected. That's sort of the prevalence so far. Again, the numbers are really sketchy. We still don't know a whole lot, and this thing is traveling pretty fast. What's the severity? Again, we don't have good data. It's being widely reported that a lot of these cases go from an upper respiratory infection to pneumonia, but we don't know how frequent that really is. So we're still learning quite a bit. There's three things that you should do. So I want you just to be aware that this is going on. Number one, watch the news. If canine influenza is reported in your area, then be aware that it's there. That means I might stay away from things like dog parks, training classes, grooming centers, in big pet stores where lots of dogs would go. I would just keep my dog away from other dogs. This thing is transmitted through aerosolized particles. And so if you're not around other dogs, then your dog should be pretty darn safe. So watch the news, know if it's in your area. Okay, that's number one. Number two, if you think that your dog might have canine flu, don't run straight to the vet. Okay, that sounds crazy. Hear me out. Don't grab your dog and run straight to the vet. Grab the phone and call your vet and say, hey, I'm concerned about this. I'm coming in. That lets your vet get ready so that we don't have a dog that might have this condition in our hospitals around other patients. They will take you. They will take care of your pet. But just give them some time and a heads up so that they can get ready and then they can receive you. And honestly, if your pet gets good supportive care, you're probably going to be okay. Okay, so don't freak out. Just communicate so that everybody gets the best care possible. And number three, don't be a carrier yourself. And what I mean by that is these aerosolized particles, this virus, if it gets onto, just a random surface, it can last there 48 hours and still be active and cause infection. On your clothes, 24 hours. That means if a sick dog sneezes on you or coughs on you, it can be on your clothes for a whole day. If another dog comes over, your dog, and sniffs you, licks you, things like that, they can get infected. It can last on your hands for 12 hours. So here's what we do. If you're around other dogs, and especially dogs that you think might be sick, how about we change clothes before we go and greet our own dog? So if this is in your area, you're dealing with high risk cases, things like that, strip your clothes off because it can be on there. Make sure you're washing your hands and doing a good job like that, just like we would if there was a human flu outbreak. And those are the three things that I would say to you to try to keep your pet healthy. So be aware if it's in your area. Call your vet and give them a heads up if you think your dog might be ill. And then number three is make sure you're not spreading it yourself and just be aware that can happen. That being said, you probably don't have a whole lot to worry about. Just be vigilant and be aware. And if anything changes and if we get more information, I'll keep you up to date.